So in the last lecture, we were discussing about peripheral nerve injuries, and in that we had already seen the classifications. Depending on that, what is the severity of the condition or severity of the injury. एक बार अपन ने खबर पड़ी जाए कि a nerve is injured to a limit. Say for example, only it is being compressed, only it is being the axons are damaged, perineurium is damaged, epineurium is not good. Depending on that, there will be treatment procedures that we can follow. This is an overall example of what can be given in such patients. Yes, this treatment and individual nerves. Say for example, radial nerve, median, and ulnar, which form the majority of the portion. Also, brachial plexus injuries are most common when considering two causes. બધાના જુદા જુદા cause છે. Yes, median nerve, ulnar nerve, radial nerve, and brachial plexus. Also, common peroneal nerve or sciatic nerve as a whole. They all have different causes. તેના લીધે ઈ થઈ શકે. Depending on the cause, there will be features, clinical features, signs and symptoms that the patient will show. Sometimes it will be sensory type, sometimes it will be motor, and most of the time it will be mixed type. Yes, we also talked about the autonomous one in the last lectures. So today, one of the important condition of radial nerve, that is Saturday night palsy. Yes, or other term for radial nerve, peripheral nerve injury is Saturday night palsy. Right? Saturday night palsy. In foreign countries specifically, not specific to India, the culture on weekends is as such they consume more of alcohol and they try to relax as much as possible. This weekend is something that is most preferably Saturday. On Saturday, they get consume alcohol, and after that they sit in such a way on the chair that the radial nerve is compressed in the lower axillary region, or you can say lower arm region. So when the patient sits, they will put the hand behind the chair and will lie down. Yes, so continuous compression of the radial nerve continuously compressed થશે. એના લીધે radial nerve palsy will be there. That is why the term Saturday night palsy. Yes. Also, in brachial plexus injuries, there are different levels, but most commonly what you see is Erb's palsy. Yes, the Erb's point, which is a point at which six nerves are continuously moving. That is being compressed. When it is being compressed, there are various signs and symptoms, specifically motor signs and symptoms. So, this is also an important condition. And of course, Saturday night palsy. You need to remember both these terms. You already know what is Erb's point, as we discussed about brachial plexus. You already know what is radial nerve. You need to remember the course of the nerve. Yes, not in this semester. This is an overview that we are looking at, but in further semesters, we are going to see various levels of injury also. Say, for example, this is the Erb's palsy. So, which are the nerves that can be compressed here? Musculocutaneous, axillary, radial, median, ulnar, all this can be togetherly compressed at the Erb's point. And also, but other term that is Clumpy's paralysis, a different type of paralysis, sometimes of something that is opposite of Erb's palsy. So, depending on the site, there will be signs and symptoms. So, where is the paralysis? What is the cause? So, there are two main causes you can say. One is the childbirth, and second is road traffic accident. For specifically, we are talking about Erb's palsy. Similarly, you are going to see for all the nerves, specifically in the future class. But not right now, we are just giving an overview. Some will be the clinical feature at shoulder, what will be there, at elbow, which movement will be there, or where will be the sensory loss, and forearm, what will be the cause and sensory loss. Policeman or waiter's stiff hand, you already know this, you might have learned it applied from me in first and second semesters. The hand remains in this position and wrist and fingers remain flexed. So the patient is always adducted, arm is adducted, internally rotated, elbow extended, forearm pronated and wrist in flexion position. This will be the treatment plan. Most importantly, why I chose this condition, it is prevalent in children. You might see the person coming to you directly and asking you what can be done on the part of medication, on the part of physical therapy. So first of all, important is एक बार कोई पण nerve injured થઈ ગઈ તો deformity, we talked about deformity જે irreversible હોય. તો શું કરી શકાય? પહેલા તો અહીંયા સપોર્ટ આપો. સપોર્ટ કઈ રીતે અપાય? થ્રુ orthosis or splints. There are different types of splints which are we are going to learn in future classes, specifically 6 semester bioengineering. ત્યારે તમે વધારે લર્ન કરશો કઈ કન્ડિશનમાં કઈ સ્પ્લિન્ટ અપાય. In which now which splint is more useful. Say for example, wrist drop, foot drop, claw hand. All this requires different types of splint, which are the principles of gymnastics for future classes. But you need to remember the splint and orthosis also an addition to say as a deformed position છે એ normal way. Yes, this will remain in somewhat extension so that contractures form નહીં થાય muscle અને બીજા soft tissues tight નહીં થાય. Tightening થાય તો there are no chances of contract. Contracture form થઈ ગયું તો એક તો deformity છે ઉપરથી ઓપરેટ કરીને muscles કે જે પણ tissues નાના થઈ ગયા છે contract થયા છે એમને elongate કરવા. Yes, so for this reason we do not want the muscles or the other soft tissues to become tight. So there are no other chances of secondary injury. This is also secondary injury. Yes, like in stroke, secondary injury, osteoporosis, DVT, all these types of things. These are all secondary. Okay, nothing કરી શકતું patient movement નથી એના લીધે બધું થતું. So same thing. Soft tissues if you are not moving, muscles move કરી નથી શકતા, extension થતું નથી radial injury. Give them splint. એકવાર splint આપી દેશો તો at least movement maintain થશે, muscle length maintain થશે અને ફ્યુચરમાં જો nerve regenerate થશે તો એનાથી movement પર easily થઈ શકશે. Otherwise પહેલા તો આપણે resection કરાવીને સર્જરી કરાવીને we have to release the muscle tendons and the belly of the. Second, for pain control, what on the part of physical therapists we can give is stents. Name itself suggests you have already learned transcutaneous electrical nerve stimulation. Nerve stimulator. Yes. So, if there is excessive pain, you can give this depending on the ascending and descending mechanism of pain wave theory. So, you are learning this from first, second semester. Electrotherapy and all subjects you have learned what is ascending pathway, descending pathway, and how our modalities IFT10 specifically they work on decreasing the pain. Same things applies for here also. Pain decrease करवा माटे TENS is much more effective because it is directly acting on the nerves. Yes, okay. Am I audible now?
Yes,
Yes, sir.
sir.
So radial nerve, if it gets damaged, yes, and there is no way it will get connected again. These both ends need to connect again for normal function. Correct? એક કપાઈ ગઈ નવ એના બે છેડા થઈ ગયા એ છેડા નજીક આવવા જોઈએ તો પાછું એનું નોર્મલ ફંક્શનિંગ થાય બટ due to any reason it is not possible. For example, road traffic accident માં the soft tissues and the nervous tissue is so much damaged કે possible જ નથી એ બે નજીક આવે. So what will we do? Lower limb માંથી કોઈ એક nerve લઈએ, common peroneal nerve, sciatic nerve, any nerve. We take a part of it, small part of it, and we graft it from there to here. Yes. So that is one of the way that a nerve grafting is done. Also, we can do nerve transfer. Radial nerve damage છે, median nerve or ulnar nerve જે નજીક છે એને ડિરેક્ટલી આપણે અટેચ કરી દઈએ રેડિયલ નર્વ સાથે. જ્યારે પણ that is a new way median nerve જ્યારે પણ median nerve ને સિગ્નલ મળશે રેડિયલ nerve પણ સાથે કોન્ટ્રાક્ટ કરશે. Yes, the signal to radial nerve also and furthermore muscles પણ contract કરશે. So you will have to re-teach the patient or what is termed as muscle re-education. You have heard this term in electrical stimulation. Yes. Yes, electrical stimulation to further types IgN SF. એમાં તમે આ વર્ડ સાંભળેલો કે મસલ રીએડ્યુકેટ કરવું હોય, મસલને રીટ્રેન કરવું હોય, આપણે મગજમાં શું યાદ કરીએ? We always remember the pattern wrist extension કરવાનું છે એમ યાદ ના રહીએ extensor carpi ulnaris ને extensor carpi radialis ને contract કરીને આપણે extension કરીએ. No, brain only recognizes the movement. So for that teaching of a new movement જે કરી શકશે patient through contraction of new muscles, that is muscle re-education, that is done through electrical stimulation. Muscle transfer directly, muscles injured થાય છે radial nerve ના. For example, flexor carpi radialis longus is injured, તો શું કરશું? Sorry, extensor carpi radialis longus is injured, તો શું કરે? Flexor carpi ulnaris or flexor carpi radialis whichever is intact એને એનું ફંક્શન દઈ દેવાનું પાછું. આમાં પણ મસલ રીએડ્યુકેશન તો કરવું જ પડશે. જે સ્ટિમ્યુલેશન આપણા this is kind of complex but if you get the point it is very easy to remember. Biceps muscle contract કરે છે. Yes, whenever you are asking the brain to contract the elbow or go for the elbow flexion તો મેસેજ કોને મળે છે? biceps ને, પણ movement કઈ થાય છે? flexion. Yes, so brain recognizes the movement કે flexion કરવાનું. Yes, a pattern developed થઈ છે over years. When you were born your brain was not aware how to do this. Yes, slowly and steadily reflexes through તમને normal voluntary action કરતા આવડી છે. Now if biceps is injured I am transferring my triceps here કે triceps contract કરે ત્યારે આ muscle or elbow flexion થાય. Yes, so what I have to do? પાછું brain માં એક નવી pattern generate કરવાની છે. નવી pattern generate કરવા માટે શું કરવાનું? electrical stimulation આપવાનું. passively patient ને શીખવાડવાનું કઈ રીતે અહીંયા ES આપવાનું and that will cause elbow flexion. So now brain will recognize કે જ્યારે પણ મારે elbow flexion કરવું છે તો signal કોને દેવાનું? biceps ને નહીં triceps. Yes, so this the patient has to learn. This learning process is muscle re-education. And last, release of soft tissue contractures. જ્યારે deformity, what we talked about, deformity causes tightness or the contractures. Yes, so tightness नहीं आना दियो तो contracture नहीं आवे, but this time tightness comes in leading to contractures. Contractures are irreversible. एक बार contract થઈ ગઈ muscle, contracture માં વહી ગઈ muscle, that means surgery is the only option. એને release કરો પછી આગળ કાંઈ પણ possible છે movements. Otherwise movement will be restricted, range of motion will be limited. That is the main aspect. Also, whenever the patient is coming to you, their age will be different. Age will be different as in it might be a patient of 2 or 3 years to up to a patient of 60 years also, which speaking of peripheral nerve injury આમાં કોઈ લિમિટ નથી, કોઈ એજ નથી ફિક્સ કે આમાં જ પેશન્ટ આવી શકે. Yes, the patient might come to you when the patient is a small child or an adult who is in the last phase of his life or a geriatric population. So at that time we need to know as physical therapist also which treatments to apply and to whom to apply. Now a normal adult you ask him to do movement elbow flexion extension they will do small gymnastic if you ask him to do never. Yes, he કોઈ દિવસ નહીં માને. They will start crying, they will look for their mother and everything. Yes, so you need to learn how to do it and that is a skill you develop when you see pediatric patients, when you see such type of pediatric patients also. So while the baby, with the baby, start range of motion exercises 2 times a week. Also the frequency is important. Out palsy, what we are seeing right now. In this, causes related two causes આપણે બે cause જોયા એક તો childbirth માં directly impingement on the shoulder level will cause the paralysis of or impingement of the Hurt's point causing paralysis of the muscle so એમાં directly training initially through passive range of motion exercise પછી active assisted પછી active and last will be the resisted so always you follow this passive range of motion active assisted range of motion active range of motion exercises and resisted range of motion exercises. This is the basic rule you follow for all the musculoskeletal as well as neurological conditions. But these conditions માટે આ લાગુ પડે. Yes. પહેલા passage start કરવાનો. પણ before that, before giving this treatment, always assessment is essential. Patient કરી શકતું હોય activity and then you start with passage that is wrong. You are hampering the level of independence and individual health. તમે patient કરી શકે છે તો પણ નથી કરવા દેતા that is a wrong. તો પહેલા આવશે assessment. પણ જો grade 0 હોય paralysis હોય you start with passive range. Passive માંથી active assisted માંથી active and active માંથી directly go to resistant. This takes more of time. બરાબર એમાં ટાઈમ લાગે એવું નહીં કે આજે passive કરાયું કાલે active assisted પરમ દિવસે active અને last course they will be the resistant. Not possible. Yes, in specifically neurological both and musculoskeletal આટલું જલ્દી progress possible નથી. This will take months or even years to reach from passive to active and resistant range of motion exercise. So starting, you start with passive range of motion exercises. Also, you always try to teach the patient something that they like. Yes, functional activities. Or functional exercises. Exercises the patient જાતે કરી શકવાના છે or they are doing in the day to day task like this figure. This demonstrates a normal individual with various levels of independence and trying to do the activities as much as possible. So flying a kite. Flying a kite is also important. Why? Because their shoulder flexion, abduction happens and also the patient will go for PNF pattern. Yes, remember the PNF pattern. So whenever the patient is trying to fly a kite, there will be various motions in which there will be functional activity. PNF pattern specifically. Sit that with weight on arms. Again, this is weight bearing. Yes, weight bearing જેટલું વધારે proprioception એટલું વધારે bone health સારી muscle re-education સારું. Four advantages just by one position. Yes, even modified plantigrade position that we discussed in stroke. If you remember. So skipping the ropes also, if the activity is of movement, yes, continuously there will be internal external rotation of the shoulders, which is also affected in cases with upper limb. You can say peripheral nerve injury. Swing from the trees, palms towards you. Yes, so that also causes more of distraction. Distraction is also essential. Proprioception જેટલું essential છે એટલું જ distraction પણ essential છે. Distraction, more of it will provide stretching and provide complete elongation of muscle. Muscle actually then not elongate. Yes, that is why stretch or you can say swinging from the trees is important. Push hard. Yes, that also increases the strength and coordination. Co-contraction. Remember the word we discussed in coordination. Co-contraction. Co-contraction is very essential. How it is essential? મારે આ પેન ઉપાડવી છે તો I will need biceps muscle, shoulder flexors બધું. Yes, but now I have to maintain this. અહીંયા આ જગ્યાએ મારે એને મેન્ટેન કરવું હોય તો શું કરવું પડશે? મારા એક તો proximal muscles બધા stabilize છે, મારું abdominal muscle as well as back extensors are contracting at the same time, same intensity. એક ટાઈમે એક સરખી ઇન્ટેન્સિટી માં છે એટલે જ હું સ્ટેબલ ઊભો છું. Yes, otherwise કોઈ પણ એક વધારે કરશે તો I'll either go forward or lean backward. Yes, so when I'm holding this pen, shoulder flexors, extensors, adductors and internal external rotators બધા જ slight amount of contraction માં છે to maintain. Elbow flexor extensors again going for contraction, simultaneous contraction, agonist and antagonist બંને એકસાથે contract કરે છે position maintain કરવા માટે, which we term as co-contraction. So pushing hard on an object or on the wall also creates such a contraction. Isometric હશે પણ it will be co-contraction. Yes, બંને muscle સાથે maintain કરશે position. That is why it is co-contraction essential for all activities. So also pushing and pulling activities. Yes, that also strengthens. Here if you are pulling back extensor muscles specifically and lower limb extensor muscles, they will go for strengthening. Washing clothes facing one direction then the other. So rotational activities, supination, pronation together, kapra niche ba. Yes, that is also a functional activity that you can teach a patient, teach a normal child, or even an adult easily. Hand the glutes. So here, coordination is needed, core contractions are needed, as well as full extension movement or full stretch position of the upper limb can be achieved very easily. That is one of the activity that you can teach. And grind the means, yes, load banao. That is also one of the activity in which coordination, utmost important. Coordination ક્યારે હોય normal muscles હોય ત્યારે muscles paralyzed હશે, muscles weak હશે તો એનું coordination કરવા માટે વધારે effort જોશે, વધારે effort, વધારે exercise, better out. So that is the basic principle on which specifically all of the rehab of peripheral nerve injury depends. So overall, if I had to summarize this, that's the treatment part. See, there are no such specific drugs. Whatever, like a medical treatment is not that important. Medical treatment, of course, subjectively it can, like say for example, pain. So you can provide analgesics. આખો દિવસ આપણે પેશન્ટને ટેન્સ ના આપી શકીએ. So analgesics or drugs are also essential. Other than that, there are no drugs that can help recover. Yes, of course. Now radial nerve is injured, એની આજુબાજુ કોઈ મસલ હતું injured થયું છે, એમાં મસલ રિલેક્સન્ટ આપી શકાય. એની બાજુ ligaments ને બધું injured થયું છે, એની માટે healing faster થાય એની માટે drugs આપી શકાય. But nerve માટે there is no drug. No drug which can help recover the patient much more faster. Yes. So medical treatment is limited to pain, which are analgesics. You already know the classes of drugs of analgesics that you already learned. We have provided in the previous conditions. Again, after that, if we talk about PT treatment, in detail, of course, we are going to learn in future, 6th and 7th semester, specifically 7th semester to be precise. But overall, for pain, prevent deformity or prevent contracture, functional outcomes, and also one more important thing is sensory. Sensory functions can also be improved through physical therapy. After physiotherapy treatment, mind is not just limited to motor aspect. We also try to improve, and there are ways in which we can improve the sensory level of activity that is affected if it has decreased to a point. For here, functional outcomes, contractures, and pain. Specifically, here we talk about TENS. You can also provide ice or heating modalities. For preventing contractures, passive range of motion exercises, and orthosis or splints that we talked about. Functional outcomes, first and foremost, you start with electrical stimulation. Now, electrical stimulation, Marpan, you have learned there are two types of current, IG and SF. Yes. So IG current we only give when the muscle is innervated. Muscle may now supply nothing, or the nerve supplying the muscle is paralyzed. So if paralyzed muscle, that means we have to give IG. But once response to SF comes, we always prefer SF. Yes, because it is more of stimulating the nerve as well as the muscle together. This test of knowing, પહેલા ટેસ્ટ કરવું પડે, assessment કરવું પડે, એમાં આવે RD test. You might have heard already this thing. Yes, RD test. Reaction of degeneration test. Like say for example, extensor indices. I want to just test કે છે કે નહીં, motor point, exactly midpoint, and then I will see IG માં આવે છે, SF માં આવે છે response કે નહીં. IG and SF બંનેમાં response આવે, that means reaction of degeneration is positive. એટલે મારે SF આપવું. IG માં આવે, SF માં ના આવે. That means reaction of degeneration is negative. I have to give IG, એટલે કે muscle paralyzed. Yes, it can never happen કે IG તમારું negative આવે. Yes, so there are only two possibilities. IG positive, SF positive, which is reaction of degeneration positive. IG positive and SF negative, that is reaction of degeneration negative. IG can never be negative. You might have already learned in electrotherapy. Yes. And for functional outcomes, electrical stimulation and activities which an individual does on daily basis. So that is activities of daily living. So patient activities happen કરતું હોય. Say for example, even a small child of 5 or 6 years of age is coming to you and રમવાની ટેવ હશે. Yes, so you incorporate such tasks in which the patient can work that way or can learn the movement by playing also. Yes, play therapy and everything you are going to see in PT Neuro 1 and 2 specifically. Sensory function also will be covered more in depth in those situations. Here the same thing that we talked about. These are all functional tasks. Up to functional. There is nothing કોઈ એક movement નથી ખાલી shoulder flexion શીખવાડો abduction શીખવાડો rotation શીખવાડો ના કંઈ જ નહીં. You are just trying to make the patient understand, make the patient aware that what all activities they do for functional tasks, those are the treatments for us. So always we talked about this in assessment part also, that if you are treating a patient, the goals જે outcomes છે એ હંમેશા patient અને individual as a therapist we both should mutually decide. હું કહું કે મારે shoulder flexion વધારવું છે, patient ને જોતું જ નથી flexion, he needs abduction. Yes, so both should talk to each other and decide what is their preferable goal and preferable outcome that the patient wants to desire from the therapist. Patient કહેશે મને પેન થાય છે એનો ઈલાજ કરો, મારે range of motion નથી જોતી, do not concentrate on range of motion. Patient just needs symptomatic treatment, that is fine, provide the same. Yes, of course you can add on. As a therapist we know કે range of motion તમારું limited છે, આગળ જતા બીજા problems થઈ શકે, you acknowledge the patient, but still if they don't agree you are not supposed to give that treatment. So this is it about peripheral nerve injury overview, just an overview. We are not going in depth because in depth specifically the PT part will be covered in your 7th semester. Yes, any doubts you have? Please let me know any doubts you have in physiotherapy part or even in other parts of what we have already described. Peripheral nerve injury. Please reply in the chat yes or no.